Javid is a fictional character, but what they went through is happening across the East Midlands today. This is their story. In Ashfield, one of England's more deprived constituencies, healthcare workers are blocked from advancing their skills, while hospital wards struggle with staff shortages. The training programmes exist, the vacant posts exist, and the people who want to fill them exist side by side, separated only by budget decisions that treat pounds like a finite resource. This is Javid's account of what that separation looks like from the inside.
My name is Javid, and I am 34 years old. I have spent the last 5 years trying to become a nurse practitioner in a health system that desperately needs nurse practitioners. This is not a story about my failure. This is a story about a system that claims it cannot afford to train the people it employs, even as those same people stand ready to learn and the training rooms sit empty. I grew up in Sutton and Ashfield. My dad came here from Pakistan in the 70s and worked at the old colliery until it closed. My mum was a care assistant at a local nursing home. When I was 16, my mum was diagnosed with early onset dementia. I spent my college years learning how to navigate care systems, sitting in waiting rooms, watching how thin the staffing was spread. The healthcare assistants were brilliant, but they were covering too much ground. The nurses were brilliant, but there were never enough of them. I saw the gaps every day, and I knew I wanted to help fill them. After finishing biomedical sciences at Nottingham Trent, I worked as a healthcare assistant at Kingsmill Hospital for 3 years. I loved the work, but I could see how much more I could contribute with advanced training. Patients would ask me questions I was not qualified to answer. I would have to fetch a nurse practitioner from another ward, adding delays to their day and mine. I decided to apply for nurse practitioner training through Health Education, England, East Midlands. In 2019, I submitted my application. I scored highly on all the assessments. The feedback was positive. I was excited. Then the waiting started. The regional office told me applications were under review, pending budget allocation from NHS England. I understood. These things take time. Funding decisions are complex. I waited. 6 months later, they called. The Treasury had constrained training budgets as part of fiscal responsibility measures. My cohort was cancelled. They were sorry. I was disappointed, but I understood. Money is tight. Everyone knows that. I reapplied in 2020, this time through Nottingham University's direct entry route. I thought maybe a university pathway would be different. It was not. The admissions office told me they could only offer places that Health Education England would fund, and unfortunately the funding envelope has been reduced. The woman on the phone sounded genuinely sorry. She said the demand was there, the university was ready to teach, but they could not run courses without the funding agreements in place. I tried a different approach in 2021. I contacted Sherwood Forest Hospital's NHS Foundation Trust directly to ask about their training partnerships. Maybe if I went straight to the employer, they could find a way. The workforce development manager was helpful and honest. She said they had 17 vacant nurse practitioner posts, but 0 budget allocation for new training places. 17 posts, real jobs, real patients who needed those jobs filled, but somehow there was no money to train people to fill them. That was when I first started to notice the contradiction, though I did not fully understand it yet. I was standing in a hospital that needed nurse practitioners, speaking to a manager who wanted to train them, as a person who wanted to learn. All the components were there, but someone, somewhere, had decided that money was the missing piece that could not be found. In early 2022, I booked a career advice session at the Health Education England offices in Nottingham. I thought maybe I was approaching this wrong. Maybe there was a pathway I had missed. When I arrived, I was directed to a meeting room on the 3rd floor. Walking through the building, I saw an entire floor of empty training rooms. Modern equipment, rows of computers, simulation mannequins still in plastic wrapping. The receptionist noticed me looking and explained that they used to run 3 cohorts a year, but Treasury spending controls mean we can only afford one now, and sometimes not even that. I sat in that meeting room looking out at a floor of unused training facilities, thinking about the 17 vacant posts at Sherwood Forest, thinking about my neighbours back in Sutton who had healthcare qualifications but were working in Amazon warehouses because they could not get funded places to retrain or update their skills. That afternoon, walking home through the town centre, I counted them. 4 people on my street alone. Sarah, who had been a physiotherapy assistant before her maternity leave and could not get back onto the register without a refresher course that no one would fund. David, who had nursing qualifications from the Philippines but could not get a conversion course place. Michelle, who wanted to train as a healthcare assistant but could not get onto the local college programme because the class was cancelled for lack of funding. And me. The people existed, the training facilities existed, the vacant posts existed, but somehow the money to connect them did not exist. That was when I started to understand that there is no money was not an accounting fact. It was a political choice. The government that issues the pound, that prints every note and mints every coin, had told me it could not find enough of its own currency to train the people who were standing right there, ready to work in the jobs that were standing empty, ready to be filled. I used to accept the excuse that there was no money. I hear it differently now. When the workforce development manager said the budget allocation was 0, she was not describing a natural law. She was describing a decision. Someone at Treasury had looked at the NHS workforce crisis and chosen not to spend the money that would solve it. They had decided that creating nurses was less important than maintaining the fiction that government spending works like a household budget. The real question was never about money. It was about whether the people existed, whether the skills could be taught, whether the equipment was available, whether the posts were real. They were. All of them. The training rooms were there. The hospitals needed the staff. The candidates were qualified and ready. The only thing standing between the problem and the solution was a political decision wrapped in the language of impossibility. I am still here. I am still watching. I work as a healthcare assistant and I am good at my job, but I see every day what I could be contributing if someone in Westminster would stop pretending that the government that issues the currency cannot afford to spend it on the people who want to serve. What happened to me is not unique to Ashfield or to healthcare. It is the story of every constituency where people and needs exist, side by side, while someone in a Treasury office says the cupboard is bare.
What Javid experienced has a name. It is called impossible expectations. This technique sets standards so high that action becomes impossible to justify. Think of how tobacco companies used to demand absolute proof that smoking caused cancer, knowing that absolute proof of anything is impossible to provide. They used impossible expectations to delay regulation for decades. In Javid's story, the same logic operated. Health Education England demanded perfect budget certainty before committing to train anyone. They wanted guarantees that every pound would generate measurable returns, that every nurse practitioner would work in exactly the right place for exactly the right length of time. They set expectations that no programme could meet, then used the failure to meet them as justification for not trying. The contradiction was visible in that empty training floor in Nottingham. The facilities existed, the vacant hospital posts existed, the people who wanted to fill them existed, but the Treasury demanded an impossible standard of efficiency before releasing the funding to connect them. A standard they never applied to bank bailouts or corporate tax cuts. The NHS is not a bottomless pit. NHS costs are measurable, and the UK spends less per capita on health than France, Germany or the Netherlands. The UK government issues its own currency. It does not need to find pounds before it spends them. The real constraint is resources, people, skills, materials, time, And in Ashfield, those resources were sitting idle. The resources existed, the people existed. The decision not to connect them was political, not financial. Ashfield ranks 141 out of 543 English constituencies in the English Indices of Deprivation 2025 from MHCLG, placing it in deprivation decile. 3. The constituency has 103 registered charities, according to the Charity Commission Register for England and Wales. Total grants received amount to £180,000, according to 360 Giving Grant NAV. All sources are published at blockedbritain.co.uk. Blocked Britain tells the stories of people whose lives are shaped by the gap between what Britain needs and what its institutions choose to provide. Every character is fictional, every situation is drawn from official statistics. Produced by Blocked Britain.